On this Sunday night, the big spending picture. Canada's ballooning deficit.
Stop hiding the mess.
How long before we get out of the red?
That is going to take many, many years.
And get the economy back on track. The WHO reports a record rise in COVID-19 cases. Plus, the summer rain and the snow melt raise red flags. And the pubs open in the UK, but Brits aren't minding the social distancing gap.
Global National with Robin Gill.
Good evening and thank you for joining us. It's a big week ahead for the nation's pocketbook. The federal government is finally preparing its first fiscal update since the global pandemic began. Ottawa went into this health crisis in the red, and that deficit will be bigger. We're learning that recipients of old age security and the guaranteed income supplement will see a one-time boost in the coming days. But the federal government has been spending on other Canadians and businesses as well to keep the economy afloat. Our chief political correspondent, David Akin, breaks down the political calculus of the government's financial plan.
For many seniors, keeping safe during this pandemic has come with additional costs. A switch from public transit to taxis, delivery of food instead of grocery store trips, increased visits to the pharmacy.
We saw seniors facing increased costs as a result of the COVID-19 pandemic, and we wanted to support them in those additional costs.
And this is the week that support will arrive. A one-time payment for those receiving old age security of $300. Guaranteed income supplement recipients will get an additional $200. And it will be automatic. Seniors should hang up on anyone who phones them up with offers to apply for this money.
Don't fall, prey to those that may be calling, telling you need to reveal some information to get the money. It's coming automatically and it's tax-free.
But help for seniors and for everyone hit by the pandemic is taking a huge toll on the federal treasury. Payments to seniors, $2.5 billion. The Canada Emergency Student Benefit, $5.9 billion. The Emergency Wage Subsidy, estimated $56 billion. And then there's the CERB, it's the big one. The Canada Emergency Response Benefit, likely to cost $71 billion. Those, plus other programs, mean the deficit could clock in at $256 billion. On Wednesday, Parliament will reconvene so Finance Minister Bill Morneau can provide some details on those numbers in what the government is calling a fiscal snapshot. Conservatives say it's a fiscal selfie tinged with red ink.
We need the government to tell us next week, how big is the deficit? How big is the debt? Stop hiding the mess.
Experts say one thing is for certain, there is no quick fix for this mess.
That is going to take many, many years. It might be upwards of a decade before they get the deficit eliminated and start paying down the debt.
Conservatives also want more money for the Auditor General. They say the number of audits has been halved over the last decade, even as government spending has doubled. And that's because the Auditor General's budget has not kept pace. And in a minority parliament, a commitment to more oversight is the least the governing Liberals should expect if they want the opposition to support their spending programs. Robin?
David Akin in Ottawa. Thanks, David. The only way to kickstart economies is by opening up, but by doing that, there's a bigger risk of contracting the virus. On Prince Edward Island, which hadn't had a case since late April, 5 people have now tested positive. The province recorded 2 new cases today. They're close contacts of one of 3 new cases reported Saturday. It's the first week of the Atlantic travel bubble. The new cases aren't connected to that. The province's chief public health officer says it is conducting contact tracing, and right now there's no indication of an increased risk, but to remain vigilant.
We are experiencing a cluster of 4 cases that appear to be related to travel to Nova Scotia and contact with an individual who had recently arrived from the United States. But this cluster of cases is a clear reminder that COVID-19 is still very much present in our province and we must remain vigilant.
In the coming weeks, Canada's public health officials hope to get a better picture of the actual rate of infection in this country. 40,000 blood samples collected since May are now being tested for COVID-19 antibodies. These tests can determine how many Canadians have been infected. More than 105,000 people in this country have tested positive since January. But experts say that number could be 10 to 20 times higher because not everyone has been tested and not everyone shows symptoms. The Cystic First Nation in southern Alberta has imposed a curfew as it tries to contain a COVID-19 outbreak. There are currently 11 active cases of COVID-19 on the Cystic First Nation. Health officials there say they are monitoring 287 people for symptoms. The curfew, aimed at stopping the spread of the virus, begins at 11 p.m. tonight and ends at 5 a.m. daily.
To tell you the truth, Alberta doesn't help by lifting these gatherings to 200. Our people are used to our gatherings, our family gatherings, our traditional gatherings and so forth. So once that number, our people hear that number, they think everything's okay, but it's not okay.
The First Nation is in active talks with the province's health services and federal Indigenous Relations Minister Mark Miller about funding shortfalls to fight the pandemic. The United States still has the most infections and deaths. There are 2.8 million cases in that country, and nearly 130,000 people have died. And tonight, experts are already warning of a second wave. That's because of the many people who attended Trump re-election rallies where no masks were required and there was little social distancing. Here's Jennifer Johnson.
The White House lit up in red, white, and blue as Americans celebrate the country's independence. U.S. President Donald Trump, ignoring health experts' warnings about large gatherings, addressed a crowd in Washington. COVID-19 cases are surging in over 30 states, but the president is predicting a quick resolution to the pandemic.
We are unleashing our nation's scientific brilliance and will likely have a therapeutic and/or vaccine solution long before the end of the year.
This holiday has looked very different. Some beaches closed, others packed with people desperate to get back to normal life. The governor of New Jersey, once part of 3 states that were the epicenter of the virus, is worried about a new wave of cases.
We're starting to see a small spikes in reinfection from folks coming back from places like Myrtle Beach and as well as in Florida, other hot spots. To me, it says we need a national strategy. We're only as strong as our weakest link right now.
New cases of the virus are breaking records almost daily in Florida, Arizona, California, and Texas.
A month ago, 1 in 10 people were testing positive. Today, it's 1 in 4.
President Trump says 99% of COVID-19 cases are totally harmless, but his own medical experts refuse to defend that unfounded claim.
I'm not going to get into who's right and who's wrong. We have data in the White House task force. Those data show us that this is a serious problem.
The pandemic isn't the only problem the president is facing right now. Come on. There are reports Trump was briefed in February about a suspected Russian bounty program, paying the Taliban to kill U.S. soldiers in Afghanistan.
The President of the United States has demonstrated absolutely callous disregard for the safety and security of American forces in a war zone.
Several members of Congress, both Republicans and Democrats, are demanding an investigation. The House Committee on Foreign Affairs will grill Secretary of State Mike Pompeo on the allegations this week. Jennifer Johnson, Global News, Washington.
In the UK, a country hit hard by the pandemic, the lockdown is easing, and pubs, considered a social institution in that part of the world, have reopened. But rules requiring people to stay apart weren't always respected when lifting a pint. And as Redmond Shannon reports, the head of England's police union says it's crystal clear that drunk people and distancing don't mix.
After more than 3 months of lockdown and isolation, England was ready to let loose. The government chose to relax rules starting on the weekend, something police did not support. In some places like central London, pubgoers spilled out onto the streets. And as the evening wore on, physical distancing was no longer a priority.
From what I've seen, although there's some pictures to the contrary, very, very largely people have acted responsibly. And my overriding message to people is, yes, enjoy the new freedoms, but do so safely, following social distancing.
The chair of England's police union was less diplomatic, tweeting, "What was crystal clear is that drunk people can't or won't socially distance." A mixed reaction too from Londoners enjoying the afternoon after.
I mean, I'm actually not surprised. I mean, like, I think people have been in lockdown too long.
There was no social distancing, there was no 2 meters at all.
It seems like everyone's just decided that the pandemic's over and we're back to normal. So, yeah, slightly worrying.
But when it comes to spreading COVID-19, evidence suggests that being outside is nowhere near as risky as being inside, which means the real problems could arise when the weather gets cold and drinking outside is less enticing.
And the whole idea of a bar is for people to be socializing and mingling, and you add the alcohol factor into that, inhibitions go down. I think it's sort of, in a way, a perfect storm.
This infectious disease expert says a COVID-19 vaccine or treatments are key to getting life back to normal.
So I wouldn't feel comfortable going into an indoor bar type setting for quite a while, I think, until we have those tools at our disposal.
Just like Canada, different parts of the UK are reopening at different times. So Wales and Scotland will be looking closely at how Saturday night affects the pandemic in England. Redmond Shannon, Global News, London.
In Australia, thousands of people living in public housing are now under a strict lockdown as infections spike in Melbourne, that country's second largest city. Police are patrolling the surrounding streets and corridors as 3,000 people living in 9 public housing blocks believed to be the center of the outbreak are now locked inside their apartments for at least the next 5 days. That could be extended if residents refuse to be tested for COVID-19. Mexico has become one of the global COVID-19 hotspots with a rapidly rising number of deaths. At 30,000 deaths, it now has the 5th highest number of deaths in the world. But the government believes the actual number of deaths could be nearly double the official count. There have been 252,000 confirmed cases of COVID-19 in the country. In the country's capital, which has by far the most cases, city officials ordered non-essential businesses to close for the weekend. Stores had recently reopened but failed to take proper steps to prevent the spread of the virus. India reported its highest single-day increase in new cases today, nearly 25,000 in the past 24 hours. In New Delhi, the government opened the world's largest temporary hospital with more than 10,000 beds to treat COVID-19 patients. As new infections rise, officials pushed back plans to reopen popular tourist attractions like the Taj Mahal, which was set to open on Monday. Coming up, the flood warnings in BC, and one community's drinking water is wiped out. It was a stormy summer day in Saskatchewan yesterday. Environment Canada confirmed at least 3 tornadoes in the southwestern part of the province as severe thunderstorms moved through the region. One twister touched down near the town of Glenbane. That's about 220 kilometers south of Regina. Several rural communities in the south were under tornado warnings until about 8 p.m. local time. People in British Columbia have their eyes on water levels. Flood warnings and watches are in place throughout much of the province. In Cache Creek, about 80 kilometers west of Kamloops, dozens of homes are under evacuation alerts. That's where Global's Paul Johnson is tonight. Paul, what's the situation on the ground there?
Robin, this is the Bonaparte River. It cuts right through the middle of Cache Creek. Take a look at it right now. You can see the water is very high and fast, and it's eroded its bank substantially. There are at least 160 properties here in Cache Creek that are under evacuation alert. So far, authorities here feel like they're holding their own right now, and if the water doesn't get much beyond the expected high water mark that they think is going to happen later this afternoon, they think they're going to be okay. But there's rain in the forecast for the headwaters of the Bonaparte River. If things do worsen here and get dangerous, they are prepared to go from an evacuation alert to an evacuation order.
The emergency support services people will give them accommodations and meals for the next few days, however long it takes. And we have several local motels that will put them up, and restaurants that will feed them.
Across BC, still a number of trouble spots connected to high water and flooding. There are about 500 people with no drinking water right now in the Seymour Arm community in the Shuswap area after a mudslide there. People living near the Quesnel River are watching the waters there closely. And of course, the Fraser River, BC's biggest, just east of Vancouver in the Lower Mainland, is very high right now, and authorities are watching it closely and warning people to stay away from its banks. That's the latest from here in Cache Creek. Now back to you, Robin.
All right, thanks for that, Paul. Tensions were high today in St. John's, Newfoundland, with some residents being asked to shelter in place for several hours. Police responded to reports of what they called unknown trouble just after 4 this morning and found a man dead. The road was closed and a shelter-in-place order remained until just after 5:30 this evening. Investigators are still on the scene and canvassing the neighborhood for information. Still ahead, why are Canadians with cystic fibrosis being kept away from life-saving treatment?
You're watching Global National.
It is estimated that 1 in every 3,600 children born in Canada has cystic fibrosis, and there's no cure. There have been recent advancements in treatment that can improve the chances of survival. But as Dan Spector explains, Canadians can't access it.
Yeah, just trying to save my life.
Montreal's Chelsea Gagnon may look like a healthy 31-year-old woman at first glance, but every single day, she's fighting just to breathe.
Last month, I actually started coughing up blood.
Gagnon lives with cystic fibrosis, a genetic disorder that attacks the respiratory system. She takes dozens of pills per day, uses this machine to loosen up the mucus that accumulates in her lungs, but it's still getting worse.
You know, each year you get more sick.
Treatments are emerging. Drugs like Orkambi have improved quality of life for CF patients during trials in Ontario. But another medication is creating even more optimism. Trikafta, a combination of 3 drugs created by American pharma company Vertex.
It's really as close to a miracle drug as you could get.
In the U.S., Trikafta was greenlit by the FDA last fall. Just this week, it came to the U.K.
NHS has just landed the deal to deliver the life-saving cystic fibrosis drug Trikafta.
Cystic fibrosis patients there were overjoyed.
So this is big.
It's everything. It's everything. They've given me life.
But Gagnon and thousands of other Canadians have not experienced that joy. The drug is not on the market here.
I'm like scared at this point that I'll pass away before I get it.
Behind one Chelsea, you have thousands of CS families that are really frustrated because this drug, Trikafta, really, it is game-changing.
Like other cystic fibrosis drugs, Trikafta can cost hundreds of thousands of dollars per year per patient. Health Canada does allow Canadian patients to apply for medications like Trikafta via the Special Access Program, and to date 122 Canadians have been given access. But not everyone is approved. To Gagnon, that's not enough.
It's really like we're in the middle of this tug of war and we're the ones who are suffering.
Health Canada says it has been in talks with Vertex since 2019, but the company has not applied to market the drug in Canada yet. Advocates say new government regulations are scaring them away.
You need to create that fine balance between attracting innovative treatments and respecting your payment capacity.
Health Canada told Global News to improve access to these medicines for Canadians, we've made changes to the rules regulating the maximum prices of patented medicines.
Just they put all these hurdles in, which are harmful to the rare disease community.
Chelsea hopes everyone who needs Trikafta will be able to access it sooner rather than later and be able to feel this kind of happiness. Dan Spector, Global News, Montreal.
Up next, young dog, new tricks. Why this Calgary canine is going viral. It may have been an American holiday last night, but Canadians living near the American border enjoyed some 4th of July fireworks as their southern neighbors celebrated. That wasn't last night's only treat. Skywatchers also enjoyed a buck moon partial eclipse. The rare lunar event saw a full moon slightly dimmed by a bit of Earth's shadow, adding a little drama to last night's festivities. At just 2.5 years old, a Calgary dog is taking social media by storm. Milo has garnered thousands of fans around the world after a few videos of his masterful tricks went viral. As Lauren Pullen reports, his owner says it's all aimed at spreading joy.
He's a cutie.
Thank you. If those unassuming baby blues didn't already do the trick, catch 2.5-year-old Milo in action. And it's pretty hard not to stop and stare.
Good job, bud. He'll grab you a bottle of Coke out of the refrigerator, he'll jump into a tree, he'll jump over a fence for you.
Yes! There. The Border Collie Australian Shepherd grabs all sorts of attention at this Calgary dog park.
It's pretty amazing. It's got some serious talent.
And that talent is now being seen around the globe.
We've had, oh gosh, I think over 80 viral videos now. It's been absolutely nuts.
Showing off his smarts.
He's super cute. All his videos on Instagram are awesome.
Some 95 tricks and counting.
I work with this guy for probably about 2 to 3 hours a day. Switch. Switch.
Jessica Gardner doesn't do it for the fame.
I figure, you know, they bring me so much joy, why not share a little bit of that with people that are going through some very difficult and uncertain times right now.
She started her journey as a dog trainer in 2016 with her first rescue pup, Shadow, who holds an incredibly special place in her heart.
I had actually gotten her for a very special reason. I had actually lost my son. I lost my son at about 35 weeks into my pregnancy, and it was really, really hard on us, you know, and I turned to my husband and I remember telling him, I need something to help me cope. My guys have pulled me through a lot.
Now a mom of 2, her kids are already taking a page out of mom's training book. The family has recently expanded by 4 more legs, sure to inspire even more internet love.
We can't control everything that's happening around us, but you know, we can control the little smiles and stuff that we can bring to people's faces, right?
And from right here in Calgary, they're spreading smiles that stretch around the world.
Good boy, Milo. Good job, buddy.
Lauren Pullen, Global News.
And that is Global National for this Sunday. I'm Robin Gill. Tonight, Your Canada is the Lower Fort Garry National Historic Site in Manitoba. Thank you for watching. Donna Friesen will be here tomorrow. Have a good night.